Has your child suddenly developed overwhelming anxiety, obsessive behaviors like constant hand washing, or uncontrollable motor or verbal tics? You may feel like something neurological is going on, but standard medical tests often come back normal, leaving you without clear answers or solutions. There is hope though. Your child may be experiencing PANDAS or PANS, two complex conditions tied to infections where the immune system gets confused, triggering psychiatric symptoms. These disorders often lead to significant imbalances within the brain and nervous system, which means that effective care must address both the immune system and the nervous system together. Getting a proper diagnosis is key, but with the right approach, relief is possible. This video is for parents searching for answers when their child's personality and behaviors change virtually overnight and other diagnoses don't quite fit. We'll help you understand how infections, immune dysfunction, inflammation, and nervous system disruption intersect in PANDAS and PANS, and how to uncover the root cause to help restore calm and balance. So Caleb's family faced an overwhelming challenge when he began struggling with motor tics, mood swings, difficulty concentrating midway through 4th grade. It seemed like their lively child had transformed overnight. After visiting multiple specialists with little relief, Caleb was diagnosed with Tourette's, and various medications were prescribed for anxiety and ADHD, but nothing seemed to work. His grades plummeted, and he began to feel isolated at school. Something was still off. Then a trusted friend recommended neurologically focused chiropractic care. Caleb's mom shared that from their first visit, they felt heard and regained hope, something that was missing from their medical journey. After committing fully to Caleb's care plan, the results were undeniable. His tics began to disappear, and today they're reduced by 90%. His grades have improved, his mood is more stable as a tween's can be, and his social engagement has dramatically increased. With his nervous system more regulated, Caleb is also working through a PANDAS protocol with his integrative pediatrician, and the entire family has more hope for continued progress. Way to go, Caleb. So PANDAS stands for Pediatric Autoimmune Neuropsychiatric Disorders Associated with Streptococcal Infections. Definitely a mouthful, and here's what that means. So autoimmune is when the immune system mistakenly attacks healthy cells, causing inflammation that affects tissues and organs. In PANDAS, antibodies created to fight strep infections also interfere with brain function. And then streptococcal refers to infections caused by strep bacteria, like strep throat. However, PANS, which is Pediatric Acute Onset Neuropsychiatric Syndrome, can be triggered by other infections such as influenza or even food poisoning, but the sudden onset and severity of symptoms are what's similar with those. PANDAS and PANS don't just affect the immune system, they disrupt neurological function, particularly in the basal ganglia of the brain, which is responsible for coordinating movement, behavior, and emotions. And then the vagus nerve, which helps regulate rest, digestion, and overall balance, is also impacted. When these systems are out of sync, symptoms appear quickly and often evade detection through standard medical tests. In addition to addressing inflammation, we also need to focus on two key issues: subluxation and dysautonomia. So subluxation occurs when tension builds up in areas like the neck and upper back, causing the sympathetic nervous system or fight or flight mode to stay stuck in overdrive. And dysautonomia refers to an imbalance within the autonomic nervous system, which can be detected using our advanced insight scanning technology, and particularly the heart rate variability scan, or HRV scan. So you'll see in the scan here that the white dot is where the patient is plotting. You'll see it's really in kind of a red zone underneath that middle line. That means the patient is exhausted. Their battery is drained. And right now it's running at about 70% efficiency. You'll also notice that it is towards the left side of the plot. That means it's stuck on that sympathetic fight or flight system. It's so stressed and wound up, and now it's being depleted. With these scans, we can pinpoint nervous system dysregulation and begin restoring balance. So PANDAS and PANS create a perfect storm where infection triggers immune dysfunction, which leads to inflammation that disrupts the communication between the brain and the body. This, in turn, causes subluxation and sympathetic dominance, which leads to further stress and dysfunction. Helping a child with PANDAS and PANS requires addressing the underlying neurological dysfunction and dysautonomia through neurologically focused chiropractic care. In many cases, an intensive care plan with multiple adjustments a week is necessary to calm the nervous system and help it regain balance. If the nervous system remains out of balance and dominated by stress, the immune and digestive systems can't properly fight off infections, even with the best diet, detox, and supplements. All these pieces are essential for full healing. Traditional medicine can leave parents feeling dismissed and without proper actionable steps, and heavy medications can sometimes worsen symptoms. We encourage you to build a comprehensive care team, including a neurologically focused pediatric chiropractor and a functional or integrative health provider. To take the first step in adding nervous system regulation to your child's care, comment below or send us a DM to schedule your child's consultation and see how we can help. Know there is hope. Both PANDAS and PANS can be put into remission, allowing your child to regain their happy, resilient self. The key is multi-layered care approach that addresses the root causes of neuro-immune dysfunction. Please share this video with any parents, family, or Facebook groups who need this. Want more information? Click the link in our bio to read the article, "What is PANDAS?" or go to our website for more information about our office.